My name is Jason Schuster. I'm a doctor of physical therapy. Before that, I was a fly fishing guide in Patagonia, Chile for a decade. Now I own a continuing education company teaching other doctors how to do a couple things, including dry needling. This is a part of my online dry needling class, Online Dry Needling 1, Dry Needling in the Autonomic Nervous System. This is about how to specifically target the autonomic nervous system with dry needling. This is a great course, you guys. You can check it out on our website, intricateartseminars.com. Check out the first part of this video series on my YouTube channel. Hope you guys enjoy it. Most people are taught to just target trigger points, muscle belly trigger points with dry needling. That is not technically wrong. It's just one of the most ineffective ways to needle people there is. It's the simplest way. It takes very, very little thought process, and it is effective. It's just not anywhere close to as effective as needling with this thought process in mind, which is the primary reason that I made these courses, you guys. If you've needled already, you can just immediately implement this stuff into your practice and maximize the efficacy of your needling. If you don't know how to needle, this will give you a huge advantage when you take a class from me or from somebody else that will give you a leg up to start immediately understanding, okay, this is what my underlying goal with the needling is. How can I go about accomplishing this goal rather than laser focusing your brain on just the specific tissues that are aggravated? Although, again, that is not wrong. That is very helpful to do. It's just not nearly as helpful as performing needling in this way. So if somebody gave me the option and they said, hey, Jason, you can needle one location only in the body, I would pick the ear 100 times out of 100. If somebody said you can only pick one type of tissue to needle, either muscle bellies or other types of tissues, I would always pick other types of tissues. So tendons, ligaments, joint capsules, periosteum, they're all much more connected to the autonomic nervous system than muscle bellies are, you guys. The tendons have the little Golgi tendon organs in them, the muscle spindles. The joint capsules have all those little types of mechanoreceptors on them. At least in St. Augustine, we were taught that there's like 5 major mechanoreceptors on the joint capsules that respond to different types of stretch or stress or heat or whatever. And I'm sure there's a bunch more than that. So we've got lots of little receptors on all of our ligaments, our capsules, our periosteum. That's much more directly connected to the autonomic nervous system than muscle bellies are. So by needling tendons, ligaments, and periosteum, we have a much better ability to affect the autonomic nervous system than by just needling muscle bellies. However, if you needle both of them, it's even better. So you want to needle muscle bellies, and you want to needle tendons, ligaments, and periosteum, and you want to target the parasympathetic autonomic nervous system. We'll get into all that as we go through class, you guys. So autonomic nervous system dysfunction. In general, you guys, when the sympathetics go up, we get abnormal efferent signals to the muscles. So the muscles and the brain start losing normal communication, and then the brain is not receiving the proper input from the muscles or the organs or any of the other structures. So it's like, I speak fluent Spanish, you guys. If somebody gave me a paragraph of Spanish to translate into English, and all of the Spanish words were misspelled, I would have an awfully hard time translating it directly into English because I'm not starting with proper or accurate information. It's the same thing that's going on with the brain. Once the sympathetic nervous system gets hyperactive and the parasympathetic nervous system gets depressed, one of the major problems that causes is it starts causing a faulty communication between the brain and everything else in the body. The brain needs as accurate information from the body as it can get so it can then return and regulate what's going on in the body. If the liver is dysfunctioning, but the brain is not receiving the proper signals about how the liver is dysfunctioning, that is going to cause a huge problem because then the brain is going to try to regulate the liver using false or not fully accurate information, and then the signals it sends to the liver are not going to be as helpful as they could be. So abnormal efferent signals to muscles, also to organs, to everything else. Spontaneous electrical activity and motor end plate noise, you guys. So that's muscle cramps, random muscle spasms, spontaneous electrical firing in the brain that happens after concussion. Same thing happens in the body when it gets tight, hypoxic, and aggravated. So spontaneous electrical activity, abnormal nociception or pain sensory pathways, you guys. So one of the things that we're going to talk about in the trigeminal nerve PowerPoint is the trigeminal cervical complex, right? The trigeminal cervical complex is connected to a part in the brain called the PAG, the periaqueductal gray. That is currently considered to be one of the primary sensory pain information processing centers in the brain. So if the trigeminal nerve in the face is pissed, that's going to piss off the periaqueductal gray in the brain. That's going to dysregulate our pain pathways. It also stimulates the locus coeruleus in the brain, which starts pumping out way too much epinephrine, which is a precursor to some pain amplifiers like substance P. So sympathetic hyperactivity leads to excessive pain and abnormal pain pathway sensory processing information through a bunch of different mechanisms. You get muscle shortening throughout the whole body. So remember, you guys, in general, sympathetics contract muscles, parasympathetics relax muscles. In general, right? So muscle shortening, the sympathetic nerve, autonomic nervous system, sympathetic nervous system contracts muscles. The parasympathetic nervous system relaxes muscles. So when you contract muscles, muscles get tight, they get hypoxic, they lose oxygen, they run out of mitochondria, they run out of energy. The whole autonomic nervous system runs out of energy, and we go into chronic energy deficiency and mitochondrial dysfunction, which is one of the 12 hallmarks of aging, right? So that's a big problem. We talked about pain. You get increased pain from nerve root compression, nociceptor aggravation, all that stuff, right? So allodynia, hyperalgesia, all that stuff. That causes more muscle shortening. And then this is just like a big, nasty snowball of crap, you guys. So whether the sympathetics, what causes the sympathetics to go up in the first place, whether you break a bone, you get run over by a hockey player, you get into a car accident, or you just stressed out, it really doesn't matter a whole bunch. Once this whole process starts, it just starts adding to itself in a negative, detrimental way, you guys. So muscles get tight, they hurt more, they get more hypoxic, they get tighter, everything gets more pissed off, it hurts more, and it just keeps going unless something is specifically done to interrupt the autonomic nervous system kind of slide into sympathetic hyperactivity. And needling is by far the number one most powerful tool that medical practitioners have at their disposal to quickly and effectively regulate the autonomic nervous system through addressing the soft tissues in the body. The other treatments that I think are the most effective are nutrition and joint manipulation, including stuff like stem cells at places like Fountain Life. Ways to Well is a great company. We'll go over some of that at the end of the class too, you guys. To maximize treatment efficacy, you want to treat the most pathologic tissues in the body. So remember, normal, totally healthy tissue, guys, doesn't really respond at all to these needles. The more pissed off the tissue is to start, the more the needle's going to hurt, the more reaction you get from the tissue. You get like indented stuff, elevated tissue, you get the red splotches, the histamine, mast cells, right? All that stuff. The reference for the book that this comes from, you guys, is at the bottom of this slide. That's a really, really good book. I highly recommend that book. That's a Western medical acupuncture book. So in Western medical acupuncture books, you guys, they still talk about the acupuncture points. So there's like 361 preset acupuncture points. However, they do not talk about the meridian system at all, because at least right now we have no way to tell like what it is or how it works. We have to have energy lines flowing throughout our body, you guys, or we'd all be dead. But I don't think they exist like the acupuncturists think they do. We definitely have energy lines. I just think they're different than what the acupuncturists think. But regardless, you guys, this is a good way to think about needling. So if you want to be as therapeutically effective as you can all the time, you want to treat the most receptive areas to treatment, or the areas that react the most to needles, right? This is not a good idea to do, you guys, if you're doing this right off the bat with a patient, especially if they're hesitant to be needled. So if the patient's like, yeah, I don't really know if I want to do this, I'm not sure, don't go into any of the most pathologic areas the first couple times you treat them, you guys. Just target the parasympathetics, target the nicest, softest, healthiest tissue that you can, so it doesn't hurt as much. You still want to make a positive impact on their brain and on their body so they feel the difference, but you want to try to avoid as much discomfort as you can right off the bat. And that will keep those patients from getting scared and walking away from treatment. So post-needling instructions. Relaxing is in general, my post-treatment instruction, you guys. So I like to recommend hot stuff, sauna, hot tub, all that stuff is great. Stretching, walking, light activity is perfectly awesome, you guys. Active range of motion, all that stuff. What I primarily don't want to do after needling treatment is do heavy strenuous exercise, because that reactivates the sympathetic nervous system, you guys. Exercise activates the sympathetic nervous system. Dry needling activates the sympathetic nervous system right off the bat, but then it results in parasympathetic dominance. So if you're needling, which is resulting in parasympathetic dominance, and then you're immediately having the patient go do something that's reactivating the sympathetic nervous system, you're just going to lose that shift that you made in the autonomic nervous system with the needling. You don't lose it totally, but it's definitely not as effective to do needling and then strenuous exercise afterwards. However, I'm not saying don't do anything, you guys, because that whole concept of like normalized muscle length, normalized soft tissue length, and then put it through the range of motion to get the brain kind of reoriented to what's going on, perfectly legitimate, good way to think about it. I just don't like to do heavy stuff after needling. With athletes, you guys, if you're an athletic trainer or you're a PT working on at a pro team or for some pro sports league or whatever, this is one of the instances where I will talk about with your players, don't do it anywhere soon before a game. But you guys, I've taught a lot of the Philadelphia Flyers medical staff, the Tampa Bay Rays Major League Baseball team medical staff, some of the Red Sox people, some of the Pittsburgh Steelers. And I always talk to them. Some of their players do like to get needled before the game, right? So I know a guy that works for the Dallas Cowboys. A couple of their players will come in but on game day before the games and just get the big moving muscle, the knots taken out of the big mover muscles, like the quads, the lats, and stuff like that. I can just tell you from experience, you guys, when I was playing Division I ice hockey in college, I'm one of the people, like a lot of people are, that get a little bit sore like immediately after needling, and I get tired. So I would not have been a good candidate to be needled prior to going out and doing heavy strenuous activity. However, some people are. I think it's way less than 50%, but it's definitely something to keep in the back of your mind and try and play around with if you are working with those types of people. So that is definitely a good thing. You can also think about more just targeting the parasympathetic nervous system, like prior to games, calming down their nervous system, improving their mental health. I know Shin, one of my Japanese acupuncturist friends, he works for the Tampa Bay Rays. He really talks about how the needling in the ears and all that stuff helps their top of the line pitchers pitch better and hitters hit better and all that stuff. Really, really cool stuff. Chemoreceptors and chemically induced pain. So most substances in our body, you guys, are paradoxical. They're necessary in certain amounts and detrimental in excessive or not enough. So we need the proper amount of these things. If there's too much or too little, there's a problem, right? So water can kill us. We have to have water in our body. If we drink too much water, we can die. Same thing with everything else. We need beta endorphin in a certain level. If it's too high or too low, it's a problem. CGRP, if it's too high or too low, it's a problem. We need it in a certain level. Same thing with like interleukin 1, interleukin 6, tumor necrosis factor alpha, all those pro-inflammatory proteins. We need them. We just don't want too many of them, which is the problem that most people have, right? So CGRP, you guys, like I just mentioned, calcitonin gene-related peptide, that's a really good example. So CGRP is a really interesting one. If you guys know anybody that takes Humira or any of those anti-inflammatory arthritis medications, a lot of the drugs in the Humira class, those are CGRP blockers, you guys. So CGRP is an interesting one. Thanks for watching, you guys. To continue this video, make sure to keep an eye on my channel. I'm going to put the part 3 out next week. There'll be many parts to this series. This is part of our online dry needling 1 course. We have 2 online dry needling courses. We have a live online dry needling course. And we have a bunch of in-person dry needling courses, all board certified and accredited. If you want a discount on our online dry needling courses, check out our school community. It's school.com/CEU, SKOOL.com/CEU. You can get a discount there on our online dry needling courses, on our online nutrition courses, and a whole bunch of other good stuff. I have weekly Zoom meetings there. We have a private community chat room. It's a really awesome community. Check it out. Thanks for watching, you guys. See you next week.